Welcome to the Behavioral Health Matters podcast, brought to you by Magellan Behavioral Health of Pennsylvania. Our podcast is dedicated to fostering positive mental health, enhancing our understanding of behavioral health topics and services, and reducing stigma. I'm your host, John Lees, and I'm the member and family advocate at Magellan of Pennsylvania. On this episode, we'll be discussing suicide awareness and prevention in the Lehigh Valley with our special guest, Jim Presto. Jim is the co-chair for the Eastern PA chapter of the American Foundation for Suicide Prevention, otherwise referred to as AFSP, and the board president for Aevidum. Remarkably, Jim dedicates his time to these important roles outside of his regular full-time employment. We are honored to have Jim with us for this episode to share his important perspective on this vital issue. Stay tuned at the end of this episode to learn how you can provide us with your feedback about the podcast and even make suggestions for future episodes. Please be advised that this episode discusses the sensitive topic of suicide, which may be difficult for some listeners. If you are struggling or need support or know someone who is, please know that help is available. You can contact the National Suicide Prevention Lifeline by calling or texting 988. Please take care while listening. And now, here's my conversation with Jim Presto. Well, hello there, Jim. Welcome, and thank you for joining us on this episode of the Behavioral Health Matters podcast.
I appreciate it. Thank you very much for inviting me to be here.
So if you would, could you provide the listeners with a little bit about your background, along with your current role at AFSP and with the local Aevidum chapters?
Sure. I got involved with suicide prevention and mental health in February of 2014, and the reason that date is I lost my 19-year-old son, Josh, to suicide. Josh was one of those young men that struggled with depression and anxiety, but he was also very much one of those young men that didn't really talk about his illness that much. So I have, like everybody else, I have a high pressure job at times, and I've had panic attacks, but those panic attacks didn't last for more than an hour. But I lose a child, but I also wanted to understand, what the illness was and what he struggled with to make him come to that decision where he pretty much lost hope and didn't see any other way out. So I spent probably the next few months talking to mental health professionals. I spent a lot of time with the county mental health just to understand what Josh endured. And, I will tell you from a personal perspective, it's tough enough to this day, losing a child in that manner, and then understanding the pain and struggles that he endured to get him to that point. So I did that for a few months. And then my wife actually found the American Foundation for Suicide Prevention. And I wanted to get more information on it. It was a few months later. So I picked up the phone and I called their Washington advocacy office, and the lady who answered the phone spent about 45 minutes on the phone with me, understanding what I lost. And I talked to her about it. And, she talked to me about depression and anxiety and why Josh may have come to that decision. So from that point, I got involved with AFSP. They have an annual Out of the Darkness walk in October. And my wife and my friends and my family all went there. And I will tell you that one of the things that pushed us to get more involved, to try to not lose people to this kind of tragedy, was we had a lot of support from family and the community. And they all encouraged us to get involved, to do something, because we're losing, you'll find out, we're losing a lot of people to suicide, and we don't have to. It is preventable. So from that time of the walk that I went to, and was so moved by that walk that I just got more and more involved with the local chapter, and just got more trained, got more involved with the board, and I kind of has gone from there. And I will tell you that one of the people with the American Foundation for Suicide Prevention, because Josh was 19, fresh out of high school, also encouraged me to look at this organization by the name of Aevidum. And I did. And Aevidum actually started in Lancaster County in Calico High School with the loss of a student. And it's where the students came together and said, you know what, we need to do something, and we need to kind of help our peers and our classmates to not lose hope and try to save lives. And from that point, we actually brought Aevidum to the Valley in 2015. And from there, it's kind of been where we are now. And as of today, I'm a board member within the American Foundation for Suicide Prevention, the Eastern PA chapter, and I'm the board president of Aevidum.
First of all, thank you so much for sharing your experiences. And I just want to say how much I admire how you've taken the loss that you experienced and really become engaged and clearly show a dedication and passion in helping others in the work that you're doing now. And I just really wanted to say that. If you could, at this point, could you share with our listeners a little bit more about the history of AFSP here in the Lehigh Valley and how your work with Aevidum chapters is integrated with the Foundation's mission overall?
Sure. I will also tell you that, I've told Josh's story just to try to save lives a number of times to a number of different groups. And I can tell you that, and I'm going to tell you straight up, I make no promises that my voice won't crack. It's been 11 years, but it's still very difficult and very fresh in my mind. So, no promises regarding my voice cracks. You just apologize. So Lehigh, FSP has been around in the Valley for more than 15 years. I believe it started with the Out of the Darkness Walk, which is a community walk for people who have lost somebody to suicide, and it's for their family and friends. And from that point of view, from that perspective, it grew from there. And today, like I had mentioned earlier, it's no longer the Greater Lehigh Valley chapter. It actually has morphed into the Eastern PA chapter, which is all of Northeast PA, except for Philadelphia. So it's been around for a number of years. I'm proud to be part of it. As far as Aevidum is, I mentioned that, we went to the very first workshop that Aevidum hosted in Lancaster County. And we asked them if we could bring this model to the Lehigh Valley. And from that, we actually had put together our first talk workshop, which is the workshop that brings students together, learning about mental health and suicide, and actually helps them to understand what it's all about, as well as gives them the opportunity to make the change within their school. So that actually started in 2015. Both organizations one calls them priorities and one calls them pillars, but their AFSP their priorities are around research, education, advocacy, and support of suicide loss survivors, as well as suicide attempt survivors. And then Aevidum's pillars are where every student in school, and this is can you imagine a school where every student feels accepted, appreciated, cared for, and acknowledged? We'd have a lot of our issues, whether it's mental health or not, we'd have a lot of our issues go away. But they're both similar from an educational standpoint. They want to educate the community so the community understands more about suicide, mental health, and risk factors and warning signs. And then Aevidum wants to teach the students who that want to learn. They want to teach the students on, what depression and mental health is, and that their friends may be struggling from something, and they're available to help. So both organizations are all about saving lives and then educating the community. Both teach that if somebody's struggling, spend the time and talk to them. Don't try to fix their problem. Don't try to be the doctor. Just help them to vent to you and let them explain to you what they're struggling with, and then help them seek professional help, because it's available, it works, and we just need to be able to guide those people, because there's people struggling out there that are struggling in silence, very much like my son. So
yeah. So it's really, to your point, it's really about promoting awareness and those first kind of few steps. And then from there, depending on what's going on and what's needed, getting them to right point of connection for additional support and assistance.
And I will tell you that, and I'm not, the expert in this, I'm not like a medical professional at all, but I also recognize the fact that there's a lot of good organizations in the Lehigh Valley, and I've learned that. And there's a lot of people passionate about this cause, about just trying to save lives, providing resources that are available to people. And if we could just kind of put a lot of these organizations together, we can actually create a stronger message. And you asked about how Aevidum can be supported by FSP. I'm telling you that the kids don't require a lot. There's Post-its, there's sidewalk chalk, there's stickers, there's wristbands. And one of the things that I've been able to do, we were able to do with AFSP supporting the Aevidum model, is that if the kids need something, we spend the money and get the kids what they need because they're driving for a good cause. So that's one way AFSP supports the Aevidum model is give the kids what they want because they're driving that great message through.
Yeah, that's great. And it's an important message, like you said, that awareness piece, but also that supportive piece within the system, because you often have different organizations potentially and different supports that are available. But if they can understand a little bit better who's out there, who's doing what, and how we can support one another, then that improves the system of care overall, I would imagine, particularly these organizations.
And now, a brief word from Magellan of Pennsylvania. Are you a Magellan of Pennsylvania member? Do you have questions about your services? Well, getting the information you need is easy. Just visit www.magellanofpa.com. There you'll find all sorts of helpful information about services. That's www.magellanofpa.com. And now, back to the show.
So we got a little bit more background that's super helpful. So let's shift gears a little bit and just talk about suicide prevention. Can you describe what the current landscape in suicide prevention looks like here in the Lehigh Valley, kind of who is involved, and talk a little bit about their activities and roles?
Sure. So I've been doing this, like I mentioned, since I lost Josh 11 years ago. But I will tell you that we are still losing around 30 people in Northampton County and 75 people in Lehigh County every year to suicide. Those numbers have not deviated. I will tell you that, and what I've learned in the COVID years, which you thought maybe because everybody was remote and secluded, that maybe that rate had gone up, that rate actually dropped. But after we came back out of COVID, that rate came back up to, to an alarming rate. We thought we were making some big progress. And I think we are to a point, and from the Valley, we're not very different than the national averages. When it comes to that, the largest population we lose to suicide is the middle-aged man. So the middle-aged man is the leader of the family. They're not supposed to be ill. They're the financial breadwinner of the company, of the family in most cases, and nothing's supposed to bother them. So they are the least likely to get assistance, but they are the most demographic that we lose. So, and in addition to that being that, we lose a lot more students in the ages 10 to 24 to suicide. And that's, people don't understand, and they also talk about 10 or 11, 12-year-olds don't understand that. Since I've been involved in a really poor way, I mean, I'm aware of students that we've lost that are at that young age, and it's very alarming and it's very disturbing. So the one area that we have gotten better is that there is tendency to talk about it more. There's also some additional reception by people that wouldn't normally have done that 10 years ago. So they're willing to learn more about it. They're willing to listen about it, and they will also acknowledge that we do have a problem. We just need to do it more and more and get to that point where we can help and reduce to eliminate the suicides in the area. I will tell you that I'm also involved with two county suicide prevention task forces, one in Lehigh County, one in Northampton County. And the one thing that I've learned is, you ask about what other organizations, who else is out there, NAMI's out there, Pine Brook Family Answers is out there. There, Lehigh Valley Hospital Network, LVHN, as well as St. Luke's. So there are people on both task forces that are part of associations and hospital networks that are involved with this and trying to help the community. So that's the putting people together, putting a lot of groups together to try to save lives, and that's a good thing. We have some work to do.
Yeah. But it's good to hear that it's, again, there are collective groups of varied organizations, all with the same goal. It sounds like, to your point, it's about getting folks organized in a way that continues to promote that awareness and prevention, and figure out ways to support one another within the system. Shifting a little bit to the folks who are both volunteers and or staff at AFSP and Aevidum, do they receive any special training? And can you talk about some of the different types of training that are available?
Sure. So with AFSP, volunteers can fill out a form online. It comes into the volunteer coordinator, local volunteer coordinator, and then they can go right into doing a virtual AFSP 101, which is the basic, what is AFSP all about, what the priorities look like, and what are the areas that AFSP works in. And the goal for that is for somebody who wants to get involved, where are you passionate about? Where are you passionate about? And so that training is AFSP 101, but then depending on where they're passionate about getting more involved, you can get trained on providing the educational programs. You can get trained on how to be an advocate within the political arena. You can also, there's a segment called Healing Conversations, which is actually the support of survivors of suicide loss. So you can be trained in all of those aspects, as well as we have a local support group for suicide loss survivors, and you can be trained to facilitate that, whether it's for the adults or for the children. AFSP will actually provide all that training so that you can do what you're passionate about, but you can also give back to the community to try to save lives. What Aevidum does from a training perspective, Aevidum is actually at that point now where we've actually put full-time staff on. It was all volunteers prior to that. And so we're looking to, how do we grow this beyond Lehigh Valley? And we have probably 300 schools in the state of Pennsylvania that have clubs, Aevidum clubs. But where that training is more focused at is actually at the students. So I mentioned the talk workshop earlier, and that talk workshop is where we will bring up to 250 students in, maybe from 15 different schools, and we will bring them into one. And so there's high schoolers and middle schoolers, and we will bring them into one school. We will actually teach them about mental health, depression, anxiety, and suicide. And then we actually will let them break out, get the network within other schools and other their classmates, and then talk about the different pillars, which is how do you be cared for, accepted, appreciated, and acknowledged. And so that's actually the formal training. That's probably about 4 or 5 hours. But Aevidum's more focused on how do we train students, because the model is, Aevidum model is that in the schools, we have a lot of good programs that are led from the administrator on down, or the teacher on down, or the guidance counselor on down. Aevidum is from the core, the grassroots up. So it's actually student-driven vertically up. It's student to student, but it's also driven vertically. So it's where the student actually has the ability to change the behavioral health culture within their school, or just the general culture within their school. And it takes time, but I've seen some very positive things. But that, from a training perspective, we're more focused on how do we get this message out to more schools, more students within those schools, because the kids are the ones that are going to make the change. And the age-old adage is kids talk to kids first. So if somebody's struggling, the chances of another student hearing about it are more likely. And if we can get the kids trained and at least talk to their fellow student and get them the help they need, then we've kind of done what we need to do. So that's kind of where Aevidum's focused on from a training perspective.
And it's great to hear that it's a student organization, like they're in control. They're really, it puts them in a position, like you said, of increasing their own awareness and being tuned in to their friends, their fellow students and others in their school community. And I imagine it translates outside the school community as well, because if this is something they're becoming involved with within school, it's hard to not have that then, kind of spill over into your own life, and maybe they've got siblings or, activities they're involved with. I would imagine it hopefully would have a kind of a bigger impact, maybe.
And it does. I mean, they'll do some of the schools, some of the clubs. One of their ideas will be they'll go to a coffee shop, right? They'll go to a Starbucks, and they'll tell the manager ahead of time that they're coming, but they'll have 10, 15 kids walk into a Starbucks and do nothing but positive messaging on mental health, on suicide prevention, on, it's okay not to be okay.
Yeah.
And they do that in the community with that intent, just to kind of spread that word. And so we've been doing this for 10 years, and I've had students come up to me and said, we learned this in kindergarten, and somewhere along the line we lost it, and now we're going to get it back. I've heard from schools and parents within their kids that got volunteered big part of these clubs is that, one of the young men told his dad, "Hey, listen, I got to go talk to a friend. He's struggling, and I just want to make sure I'm there to talk to him." So the messaging gets through. They do a fabulous job.
That's really great. So again, shifting gears a little bit more and getting more into the data and just some of the facts that might help to tell the story a little bit more. Are there statistics that you can share with our listeners that might help to illustrate the issue of suicide across all ages?
Sure, there is. So generally speaking, overall nationally, suicide is the 11th leading cause of loss of life. If you drive into the age groups, I mentioned 10 to 24, 10 to 34, it's the second leading cause of loss of life. And just to put a kind of focus on that, 10 to 34, number one is accidental. Number three is homicide. So we actually lose more in all these categories. We lose more people to suicide than what we see on TV every day, right? We see on the news about people dying by homicide. 35 to 44, it's the fourth leading cause. 45 to 54, it's fifth. And then 55 to 64 is the eighth. And so, like I said, in all cases, we lose more to suicide than we do to homicide. But just to give you some other details, so we lose more men than we lose women. 3.85 times more men die by suicide than we do women. White males are also the larger portion at 68% of suicide deaths. And this is not a Second Amendment comment, but the most lethal means used is a firearm. That's all the really bad news. The one positive news that I mentioned about, the words getting out, people are understanding it more and willing to at least talk about it more. On that same survey, 94% of adults surveyed think suicide is preventable. That goes against the age-old thinking that if they're going to do it, they're going to do it. That's not, and I'm not a doctor. There's enough research out there to tell you that that's not accurate. And now I think that message is starting to resonate with people, which is part of the positive things that are moving.
Yeah, and I think a big credit to a lot of the work that's being done, to your point, at the grassroots level to help to raise awareness and ideally to hopefully help. I mean, conversations like what we're having, not necessarily an easy conversation to have, obviously, but an important one. And I think the more that people are exposed to these kinds of conversations and, for example, the Aevidum work that's happening in schools, just by being more tuned in and maybe someone feeling a little more comfortable to reach out for that help, that's a big number. You said 94% feel it's preventable. Yeah, I mean that's obviously a very big number. So, as eye-opening as the other statistics are, that seems to provide some measure of hope that word is getting out and continued work hopefully will continue to ideally drive down the numbers of suicide and suicide attempts.
The one thing that I actually wanted to also mention too regarding statistics in general, and it's kind of from a task force, it's where you want to be focused on because we work with the hospitals. There's a very high statistic of people that go on to die by suicide that have actually visited the hospital within the prior 6 months. And then where we really want to be focused on is there's 1.6 million suicide attempts. Mm-hmm. Okay. We want to get to that point of trying to prevent people from getting in the crisis, but we want to make sure that, we talked earlier about how do some of these organizations get together and kind of help each other. In both counties with the hospital, they created what's called a warm handoff. And that warm handoff is where somebody comes in to the hospital that attempted, okay? So they get the medical and behavioral health support they need for the time that they're in the hospital. And then they get a treatment plan. And then, as you well know, some people get out of the hospital with the treatment plan. I'm okay. That was 3 days ago, but that problem's still lingering, right? So what the warm handoff does is that the hospital will, make sure they comply with HIPAA, but they'll actually provide the information on approval from the patient. And then the county will actually pick up the phone and call them and say, have you been able to schedule your appointments? Let me help you. So they're now helping them get into that treatment plan to make sure that they can get the treatment plan. And then there's actually studies that show that you will actually greatly reduce the attempts after that point if you can get them the support. So the interesting thing and the great thing is that that's one of the things that came out of both of these task force with all these organizations together is that warm handoff, which is working.
Yeah, it sounds like a great example of what we were talking about. Like you said, it's that collaborative spirit within the system. And I would imagine on the person who had been seeking the help, that follow through, that additional contact and outreach, I'm sure could make the difference in making sure they may have some logistical barrier that prevents them from getting to their follow-up appointment or something along those lines. And if they get a contact, they can help to kind of troubleshoot that and make sure that connection is made, and hopefully make them more likely to follow through with their care and get back on the path of recovery and feeling better.
And now a brief message about 988. If you or someone you know is experiencing a mental health crisis, thinking about suicide, or simply need emotional support, the 988 Suicide and Crisis Lifeline is here to help. You can connect with trained counselors by calling or texting 988. It's confidential, free, and available 24/7 across the United States. Reach out. There's hope, and there's help. Call or text 988. And now, back to the show.
What are some of the challenges that you face in doing this work?
Well, I don't think most people understand what some of those challenges are. We still have the stigma and taboo, right? So we have stigma around mental health, and where I struggle from where I perspective, and I'm hoping that I would be this way prior to losing Josh, but it's like the brain is one of the largest organs in your body. And when it actually has a problem, we don't seek the help that we need to get to kind of work through that. And then there's the taboo, right? Then there's the taboo around, you know what, you lost your child to suicide. What's wrong with you? What did you do wrong? What didn't you do? What should have you done? I don't think people need to judge anybody else, because if you lost somebody in this manner, you do enough of that self-reflection and beating yourself up. So I think those are still around. Those stigma and taboo is still around. It's a little better, but it's still there. Specifically around, I have student leaders that we have to make sure of self-care with the Aevidum student leaders. But, when they actually start pushing out into the school and they hit a classmate that absolutely has, an attitude or incorrect information about mental health and suicide, there's some of those challenges that, our student leaders see that. I mean, I can see that in, my own community interaction when I talk about it. So, it's a difficult thing right now. And we still need to just kind of break those barriers down and kind of remove that stigma. And that's kind of what we're dealing with right now. And I think that's from, to me, the way I look at it is that I give them a little bit of a benefit of the doubt, and I say they're not educated enough. And I said to you, before I lost Josh, hopefully I would have felt this way. I can't tell you that then, I hope I would have, but I give them a little slack, and I tell everybody to cut them a little slack because they're not educated. They don't quite understand what it is. And hopefully they never have to. But, to me, it's more about just continually educating. And I've educated people from classes of 3 people to classes of 200. So how do we keep getting that word out? So we just keep driving. But the major challenges are still stigma and taboo.
Yeah. So for those who might receive support through these organizations, did these services cost anything? And then can you talk a little bit also about any activities or special events to generate the funding needed to help stand up these important services and supports?
So from the American Foundation for Suicide Prevention, their offerings are free. Their educational programs are free. The trainings that we do for volunteers, the support groups are free. Our biggest form of fundraising from a AFSP perspective is what we had talked about earlier, is the Out of Darkness Walk. So there's 3 of them. There's a campus walk, there's a community walk, and then there's the overnight walk. And the overnight walk is held in 2 different parts of the country, and it's actually a walk for 16 hours overnight. We actually hold 2 campus walks, one at Lehigh Valley colleges. We have a group of colleges within the Lehigh Valley that get together to raise money and actually put these walks on. And then Kutztown puts one on, as well as we hold the one in October, which is the community walk. And that last year we had about 1,600 people. So those walks were initially started for support of survivors of suicide loss. That's what the walk's all about. It's so people who have lost somebody to suicide, whether it's a friend, a family member, and then bring other people with you to kind of spend a day, spend a couple hours talking about your lost loved one, and then kind of share some good memories. It's also a fundraiser. And I can tell you that I'm continually blown away. We get sponsors, which is great, but I can tell you that the people that walk, 1,600 people in the Out of the Darkness community walk, and about half of them raise money, but they raise an amazing amount of $70,000, $80,000, $100,000 a year. And they do it tirelessly, but they do a great job. So that's actually, it's what supports our research, education, advocacy, and support of survivors of suicide and loss. So from a fundraiser, from an understanding of the money perspective, what the way AFSP operates is, so if we raise $100,000, $50,000, 50% of that money stays within the chapter. So it stays within the community to support and spend, to support even Aevidum or support any other programs that work with under the priorities. And then 50% goes back to national. One of the things that I can tell you is that AFSP raises about $35 million a year, because they have chapters in all 50 states, and there's walks all over the country. And about 17%, and this is in actually every one of the presentations on AFSP, 17% of those funds is used for overhead. So there's 83% of that money is put back into research that actually develops the educational programs, that works on the advocacy, that works on support survivors information. So it's a very good organization that spends a lot of money back into the suicide prevention initiative. So it's really good. But programs are free, and actually most of the fundraising is done through these walks.
That's great. I mean, I think that again, part of the challenge might be for some people monetary, right, or economic, and so by removing that as an issue at all, I think that probably helps just in your goal, like you said, of engaging with folks, making sure they know there's support available. There's no cost associated with it. And then I'm thinking about transitioning in terms of if someone wanted to, was interested in getting involved either as a volunteer or in some other way, either with the foundation and or with an Aevidum chapter. Is there a way for folks to do that and or find out more information, different social media sites, I'm sure, et cetera?
I will tell you that both organizations have social media, Facebook, Twitter, or Facebook X, Instagram, all the social media sites. But if you go from an AFSP perspective, if you go to their website, afsp.org, there's actually, if you've lost somebody to suicide, by all means, go to afsp.org, because right on the top it says, I've lost somebody. And there's reading information, there's video information, there's you're not alone information, because it's interesting that we tell people that struggle from depression that they're not alone, but we're also wanting to tell people that are struggling with this grief of suicide and the tragedy and all the questions that come along and all the emotions that come along with it, that you're not alone as well. So go to that site. And then if you wanted to get involved, you go to afsp.org. There's actually a link that says get involved, and then you can volunteer with AFSP. It'll walk you right through. It'll walk you right through the chapter, and then you fill out a form. And what happens is that form comes back out to the local community, the local volunteer coordinator, and they will reach out and they'll go through and give you the suggestion to introduce you to the training, and then it can kind of go from there. So you can volunteer as little or as much as you want, but you can go to afsp.org and to get involved, and we would love for people to get involved. As far as Aevidum's concerned, you can go to aevidum.com, and then there's a contact link right on the top, and you can fill it out in one of couple different options that are on that page. And then people will get in touch with you from there. So we are always looking for people that are passionate about this cause, whether it's from a youth perspective or from the youth adults perspective with AFSP, because we always need help with people in different areas. So,
and now a brief word about 988. If you or someone you know are struggling with your mental health, feeling distressed, or thinking about suicide, there's a simple number to remember: 988. Call or text 988 to connect with trained counselors. It's free, confidential, and available anytime. Remember that number. It's 988. And now, back to the show.
So shifting gears again and looking a little bit toward the future, what are some of the goals for the organizations, AFSP and Aevidum, in terms of, and we can think about near term, so kind of what's on the more immediate horizon, but then also longer term goals. What are some of the goals in terms of the future? And then what is needed to achieve these goals?
So with AFSP, there's a lot of specific goals around their research, and they actually share that research with their chapters and develop programs within that. So we had talked about earlier, the biggest demographic is the middle-aged man. How do we reduce that? How do we reach out to that demographic? Because that's the other challenge from a community perspective. I worked with a young man that did a basketball tournament, and he did it because he lost a friend to suicide. And he did a really good job because, basketball players are 18 to 35. And he got all those kids into, I call them kids because of my age, but he got all those kids into this basketball court. He probably had 15, 20 teams. And, when I walked away, I'm like, that's a group of the community that I would have never been able to touch. But because he held this event, so trying to figure out how to reach people where, the middle-aged men where they are. And I will tell you that one of the things that we found out was a lot of people within that middle-aged group that we lose to suicide are involved in the construction trade. So AFSP has actually started an initiative. They started with a walk, which is called the Hike for Hope. And we held 2 in Pennsylvania, hope to do 3 next year, but that's actually targeted at the construction industry because, that industry can get peaks and valleys from layoffs to full-time work to a lot of things. And then people are laid off and they have to worry about their family's financials position. So there's a lot of people that we're losing in that regard. And actually that's a national average as well as the Lehigh Valley average as well. So we start to focus on them. And the next area that has shown with the research that's coming out of AFSP is that there's an acronym called BIPOC, which is the Black Indigenous People of Color. That we see an alarming trend of losing, especially the younger group of people. We see a growing number and an alarming trend of suicide in that regard, and that's an interesting section of the community because I, as a white person, cannot go to that community and try to convey or educate anything because I don't understand their culture. I don't understand what they've endured in their life, and I don't have an understanding. So we're actually looking and trying, and there's training programs and educational programs specific for that community. But we also need people that understand that community and that culture in order to train that. But I can tell you that that's a big area of focus right now because there's an alarming trend of suicide losses growing in that community. So the Aevidum portion of it, it's actually grown to the point where we do need volunteers. And we're, the goal for Aevidum is actually how do I get Aevidum throughout the entire state of Pennsylvania? And how do we scale and grow from there? We have strategic plans within that world. And how do we scale up and get more people involved? And we need more trainers and engaging the schools and department, different areas of outreach. So, if people want to get involved, I had to mention that we just put on and hired full-time for the first time with Aevidum as opposed to all volunteers. So we're actually moving in a very good direction. It's growing, and we're just looking for more volunteers to get involved in to kind of help us through that.
Well, hopefully this conversation that we're having in this episode will help to grow those numbers even further. And it sounds like those goals going forward, you're identifying even within the population, particular, groups that might need some more targeted outreach and get, figuring out where to connect with them and continue the work. So certainly very planful. And I just, you're always looking at continuous improvement in anything you do. And so it's about, what works and continuing to build on that, but also being aware of what what nuances, what other areas can be, evaluated, and then, bring some other resources and supports to bear. So I think it's great that the organizations are in the here and now, but also looking to the future as well. I'm sure that that's very beneficial, both for those providing the support, but also receiving it, of course. So you touched on this a little bit earlier when you talked about stigma, but we typically, this podcast, one of our pillars is to try to have conversations and do a small part to help reduce stigma specific to mental health, substance use. And so, again, the hope would be that through the course of this conversation, folks will listen and maybe feel a little more comfortable to have conversations themselves. But you've been doing this for some time now, so we typically ask each of our guests about stigma specifically. So I'd be very interested to get your perspective, having done this for a while, about stigma and whether or not you see that we're making any progress in reducing stigma overall as it relates to mental health and certainly suicide.
I will tell you that we are. We're going in a good direction. Like I said earlier, we do have a little ways to go, but one of the things you wouldn't have seen on TV maybe 10 years ago is on the NFL Network. A few years ago, AFSP, NAMI, the National Alliance of Mental Illness, the JED Foundation, and the Ad Council got together and created this program called Seize the Awkward. And it's really all about having an awkward conversation, having a difficult conversation, because asking somebody about, you're concerned about them and asking them questions, pointed questions like, have you considered taking your life, are very difficult, dark conversations to have. And what this was is this made a joke kind of out of that conversation, but it's called Seize the Awkward. And actually what I noticed is that the NFL Network picked it up a few years ago. So their commercials, you'll see their commercials on Seize the Awkward, which was pretty cool. And obviously I would be a little disappointed if not a lot of people right now, being Mental Health Month is May, if you didn't hear about that on TV, because we're talking about it. There's advertising coming out about it. It's just trying to drive more information out to the community and to the viewers of TV, and just getting that word out. So it's definitely better, because I don't think. Listen, I have a family that's old school. And even though I lost my child, there's still some old school thinking in that regard. So I understand what that stigma looks like. But I think from where we are, where we were, and where we're going in the right direction. I think more people are getting out, word's getting out, advertising's getting out. So we can only do, what gets better. I think where we need to understand is that mental health is truly medical health. It's truly something in a lot of cases that you didn't cause, it wasn't your fault, and there's help available. Go get some help. You deserve the help.
You see gains being made. I've seen those ads as well. So I do think, we can identify other ways to get the word out about mental health, as you talked about, suicide, using different mediums, whether it be television ads, online, social media, helping folks to understand, that it's, I think you had said it's okay to not be okay, but then beyond that, where is the help? And so those within the system, being available and working collaboratively, hopefully really through those approaches, we can continue to have more of these conversations, help others to be encouraged to maybe ask for help or reach out to someone who they may see struggling and have that conversation. I agree with you 100%. The more that, you can do in that way, I think can only benefit others. And I think you said it best earlier. You said it's about saving lives at the end of the day. So this brings us to our final question, which we ask each of our guests, and it's our one thing question. So we've covered a lot of ground and talked about a lot of different issues. But if you had to pick one thing for our listeners from this episode to walk away with as kind of a key takeaway, or, something new that they may have learned, what would that be?
So I do this with all the trainings that we do. I do this with anybody who listens. So, you know your friends and family. You know your friends and family better than anybody at times. And, if you see a change in them, and I don't care how old they are, but if you see a change in them, and that change lasts for 2 weeks or longer, start a conversation. Ask them if they're all right. Tell them that you've noticed a change in them and you want to make sure that they're okay, or you want to know if something's bothering them. Find out if they'll open up. And I'm not saying that because if somebody changes and it lasts for 2 weeks and you open up a conversation that they may be suicidal, they may be thinking about it, they may be in crisis. They could be bothered by anything, and it can be anything from a work-related issue, a school-related issue, a relationship-related issue. It can be anything. The thing that education taught me is that if you have somebody that's struggling and has a mental health issue or a depressed issue, and there's more than one thing happening at the same time, the chances of them going to crisis get bigger. So just ask a conversation. And then if you're seriously concerned about them, ask them if they've considered taking their life. And some people will say, well, if I say that, then I planted a seed. Well, the truth is research shows that if you say that, technically what you will do is you'll break down a barrier, because if they're thinking about it, it's already there. You asking them is not planting a seed, but you asking them has broken down a barrier that maybe they'll talk to you a little bit about a deeper thought that they have with regard to that. So it sounds easier said than done. I know the conversations, having a difficult conversation and spending the time may be a little bit more difficult, but if it comes to saving a life and you see somebody and you have a family member or friend that has changed and you see a change in them, just start a conversation with them. Because if you look at all the educational programs out there from a NAMI, from an AFSP, from the American Suicidology, it's all about starting a conversation. So if you see a change and somebody's bothered by something, ask them if they're okay.
It's a great message. Great message. Great takeaway for our listeners. And as we wrap up, I just really want to take a minute to say thank you to you. We really appreciate your taking the time to sit down with us, to share your story and the work that you've been doing, and your willingness to be a guest on the Behavioral Health Matters podcast. We wish you nothing but the best going forward with all of the work, but really want to just say thanks again.
No, I appreciate it. I appreciate you guys doing this podcast and just an opportunity to get the message out. So it's been a great honor. Thank you.
Thank you again, and take care. Stick around. We'll be right back to wrap things up. So what did we learn on this episode? Well, we learned that suicide remains a significant public health problem in the United States and worldwide. But despite that, we learned that there are reasons to be hopeful. There are organizations leading efforts to educate the public, raise awareness about suicide prevention, and trying to help save lives. And we learned about 2 such organizations in our area doing some very important work. We learned that the American Foundation for Suicide Prevention, or AFSP, focuses on research, education, advocacy, and supporting survivors. And Aevidum works within schools to foster a culture of acceptance and care among students. Both organizations share the common goal of providing education and awareness about suicide prevention, believing that increased understanding can break down stigma and save lives. If you're interested in learning more about these organizations, for AFSP, you can check out their website at afsp.org. And for more information about Aevidum, go to aevidum.com. And please remember, if you or someone you know are feeling overwhelmed, facing mental health struggles, or having thoughts of suicide, help is available. Speak with someone today by calling or texting 988. Thank you to our guest for this episode, Jim Presto, co-chair for the Eastern PA chapter of the American Foundation for Suicide Prevention and board president of Aevidum. Thanks to all of you for listening to this episode, and I hope you'll join us for our next episode. And remember, if you have any questions or feedback about the podcast or future episode suggestions, you can email me directly at jglees@magellanhealth.com. And if you like this episode, be sure to hit the like button and subscribe to our channel for more Behavioral Health Matters content. There's the music letting us know we're out of time. I'm John Lees, wishing you all the best until next time. And please remember, behavioral health matters.